record. Change that setting and it's still doing it. That big.
I am not annoyed by that. I promise. It's so not a horrible thing.
All right. Maybe it's just me. Okay, I'm going to admit everyone now.
How many students is it?
We have up to 78. We've got 63 in the room with us right now, 64.
Oh, wow.
So good number.
Okay.
Yeah, some people, you know, we're having good attendance, so I think we'll probably see most, and some will join us late. So hopefully.
That's good.
Okay, everyone, welcome back. We've got Dr. Tosi Guilford with us from the PA program, and she's going to tell you about physician's assistant and the expectations for school for physician's assistant. So Dr. Guilford, I'll let you take it away. Thank you. Thanks for joining us today.
Thank you. Thank you for having me. How are you guys doing today? I'm gonna scroll through the pictures. Oh, we have 3 pages. Okay. So how are you guys enjoying SHPEP online? So I'll let y'all know that I'm very interactive. So you guys can, some of you can unmute yourself so we can hear you kind of talk. If not, it'll be a very uncomfortable conversation for an hour and a half. So how are you guys liking being online? How's the program so far?
It's pretty good. I think everyone would like to be in person, but I guess it's the next best thing.
Okay. So what student population do we have? What year in school are you guys? And you can just unmute yourself and.
Rising junior.
Okay.
Sophomore.
All right.
Rising.
Do we have any freshmen or seniors?
Senior.
All right, you can put in the chat. I'll monitor the chat as well. So how many of you want to, well, let me ask this. How many of you guys have even heard of the physician assistant? So it's physician assistant, not physicians possessive with the apostrophe S. But how many of you have heard of the physician assistant profession? So many of you, have some of you not heard of a PA before? Very popular nowadays. Yes, it is the #1 profession, up and coming profession in the country. So actually when I was in kind of at your age, most of my friends and colleagues, our classmates didn't even know what a PA was. I think I was a little bit more aware of the profession because I have both of my parents are PAs. They've been practicing for about 26 years and my mom has been practicing for about 33 years. And so I was well aware of the PA profession. But I do find that most of the students that I come in contact with, even the ones that are in college, have never heard of a PA profession. So I do try my best to try to make contact with students, even as young as junior high, because I do think it is really important to make sure that we touch those students when they are young to make sure that they are indeed competitive. You guys have probably, most of you from the chat have heard about the PA profession, and you, someone commented on how popular it is. And with popularity comes competitiveness. And so it was rated by US News and World Report the #1 profession, and I think that has been for the past couple of years now. And so it is very, very popular. But like I said, if you have a profession that's really popular, then you have more people that are applying to the programs. There are a lot more people that are interested. And what that means is it's going to be a lot more competitive. And so they introduced me, my name is Tosi Guilford, Dr. Guilford. I am the PA program director for the UAB Physician Assistant Studies program. There are about 230, maybe a little bit over 230, less than 235 programs across the country. And there are a lot that are in the pipeline that are coming up for provisional accreditation. But right now there's about 230 accredited programs across the country. They are becoming a lot more competitive. So I have been a PA for 21 years. I'm also a physician. I went back to medical school when I moved to Alabama. So I'm originally from Los Angeles, California, where the PA profession is really, really popular. There's a lot of positions that are open. You have PAs that are working across multiple fields, multiple medical and surgical subspecialties. However, when I moved to Alabama, there weren't a lot of PA positions. And they really didn't get paid a lot. So I probably could work at McDonald's as a manager and get paid a lot more than what I was getting paid when I moved here in 2000. We have seen a drastic change in the role of a PA and all of that over the past 18 years or so since I've been here. But during that time, I went back to medical school once I moved here to Alabama. So before we kind of get into the PA profession, I know a lot of you have heard of it, but a lot of students at your stage in their education don't really know the ins and outs of the profession. So someone let me know, why do you think someone would want to choose the PA profession opposed to going through medical school?
One reason can be, I believe the PA program is only 2 years after undergrad instead of med school, which is 4 years.
Okay, so the time commitment, all right. Any other?
There is a set work times, usually from 8 to 5, so you can balance your family life if you're trying to work there.
So you mean once you get certified and work in practice, you would work from 8 to 5?
Yeah, it's there's a set times, not fluctuating the medical field.
Okay. Anything else?
Because you have an agreement with a physician, you don't have to worry as much about insurance and office procedures because they'll take care of that in a lot of places.
Okay. Anything else? Financial, someone said financial, more flexibility. Yes, more affordable. More focus on patient care. We hear that all the time, and that is true. Anything else?
Dr. Guilford, there was a question that you might have missed from Hannah.
Oh, the PA versus MP? Yeah. We'll get that. Specialties, yeah. So y'all hit mostly all the big ones. And so these are all the reasons most people do choose the PA profession. So, and I kind of ask that because we always get someone that kind of falls into the trap that a lot of PAs choose the PA profession because they can't get into medical school. It's almost like a default type of a career for them. And so I would say maybe when I was in school in 1998 or early 80s, so the PA profession is very, very young, and we'll talk about the history of it. It only came into play around 1965, was the first cohort of students that matriculated into a PA program. And so it is fairly young. And I think in the earlier days, you did have a lot of practitioners that joined or that were interested in the PA profession because they may not have been able to get into medical school. They didn't have the MCAT to get in, or for whatever purpose, they went into PA school. But I do think that has significantly changed. And I think it has changed a lot because students are a lot more educated about the PA profession ahead of time. And to be completely honest, we really do not, we try to steer away from admitting students that suggest that their number one choice would have been medical school, okay? So really, you guys need to know that there are a host of other professions, healthcare professions that you can get into that is outside of medical school. There are students that want to be called doctor, that want that MD, you know, behind their name, and there's nothing wrong with that. I think if you are completely honest with yourself and you understand why you are choosing a profession and what you're seeking from that profession, and what drives you to that, you have to be completely honest with yourself. And if you want to be kind of in charge, if you want to make all of the big, tough decisions, have a team of people to kind of follow you and rely on you to make those big decisions, you know, if you want to do that and be in charge of that team and be called a physician or have the MD behind your name, then that is completely, you know, okay. And then I would really encourage you to make sure that you seek that profession and do whatever you can to be successful in that profession. But you should know that you can still be a leader. You can still have other providers look up to you and look to you to make tough decisions, and really be maybe not in charge of the whole team, but you are making decisions to make sure that that team is moving in the right direction. And you can do that as a PA, all right? So just kind of give you a little bit of background about the PA profession. I did say that it's fairly young, a fairly young profession. And it really was created in the mid-60s in response to really a shortage of physicians. Right now, there's a lot of PA programs that are being, that are opening and applying for accreditation, really to kind of increase physicians or healthcare professions in these indigent areas, in underrepresented or underserved health shortage areas and things like that. But in the 60s, when the profession was born, it really was in response to a shortage of physicians. And so what healthcare professions or physicians did was they saw that we had Navy corpsmen and medics that were helping patients in World War II, and they used that same type of medical officer training that they had in the war. They brought that back to civilians in the country. And so what they thought is, you know, you really don't need a physician to see all of these patients. You can actually train someone to be able to assist you in whatever field that you are in, and train them to do exactly what you need them to do to make sure that you can treat and have access to a lot more patients. And so that's kind of where the profession was born. The very first PA program was developed at Duke University in 1965. And then our program actually is the second oldest program in the country. So we opened up in 1967 and graduated our first cohort of students in 1969, all right? So when the profession was first born, a lot of those PAs were in the surgical field, really with urgent care and intensive care and things like that. But right now, PAs, you can see PAs practicing in every single subspecialty of medicine or surgery, and also psychiatry. And so if you are interested in being very flexible, if you really don't want to commit to one thing and work in one area over the course of your life, then this healthcare profession would be really good for you to try to seek. And so we are the second oldest program in the country. We did start off as being a surgical assistant program. So we used to graduate SAs, surgical assistants. And I do think that is kind of the problem that we saw when I moved here in 2000. Most of the PAs that were working here in the city, they actually were working in the operating room. And so they are first assist. You really didn't have PAs that worked in the hospital setting, and you also didn't have them working in the emergency room, and surely didn't really have them working in private practice. And so most of the programs across the country are all what you call general PA programs, which means that they train their students to work in primary care or surgery, and there's really no focus. So those students are able to work in any type of surgery or medical field. Our program graduated all surgical assistants, and the only thing that they did was worked in the operating room. In 2014, we did change that, and the program is now called the Physician Assistant Studies Program. And so although we graduate PAs and we really don't graduate SAs anymore, we are a surgically focused program. So what does that mean? Out of the 230 odd programs that are open in the country, there's only 2 surgically focused programs. That is our program at UAB and also at Cornell University. And so our program is very competitive. We do have students that come here from all over the country, even though they have PA programs that are right there in their surrounding cities or in their state. And they choose to come here because they want that surgical focus. And when I say surgical focus, we don't just have extra courses. We do have a whole year, 2 semesters of surgical disease where we're teaching students how to medically or surgically manage medical illnesses. But they also have what we call a pig lab. So they do surgery on huge pigs, not your Charlotte Web pig, but huge pigs that they purchase in the operating room within the medical school, and they do surgery on the pigs. And we use the pigs because they have a very similar or almost identical anatomy to humans. And so they're learning how these are pigs that are anesthetized, so they're put to sleep. And they remove gallbladders, they remove spleens, they remove kidneys, sections of the colon, so they do colectomies. All of that they're trained to do. So when they do graduate and transition into practice, they don't need any additional training. And so a lot of most of the surrounding cities and states, they hire our students because they know that they'll be ready to transition to practice with little to no additional training, okay? I hate that we're doing this on Zoom because we usually have you guys come into our lab and have you do some active applicable exercises. So we have a lot of models. So we have pelvic models and heart and lung models and things like that the students can really kind of interact with and the idea of what that training may look like. And usually by the time we finish, I have recruited a few more students that are interested in the PA program. But via Zoom, I'll just kind of tell you guys a little bit about the program and let you know the difference really between PA, MD, nurse practitioner. Do you guys have any questions about the history of the program thus far? No? Okay. So I said that our program is a little bit more competitive than most because of our subspecialty. So we have our CASPA application cycle. So that is kind of a centralized application cycle that all students from across the country, and there are only PA programs in the country that are accredited by our accrediting body. There are some that are open in Canada, but they're not accredited by the ARC-PA, which accredits US territory PA programs. So that central application process goes through CASPA, and it just opened. We usually have about maybe 1,500 to 1,600, sometimes 1,800 applicants a year. And we look through all of those applications to verify them and make sure that everyone is meeting the prerequisite requirements. And out of all of those applicants, we have probably about 900 that meet the requirements and that we could potentially bring on campus for an interview. And then we have kind of a process, admissions process, where we look through all of that and we choose the top 164. So out of all those applicants, we will bring in, we will bring in, 160 something applicants. So we double. We only let in 80 applicants, and we double that and bring them in on campus. So out of all of that, it trends down to 80 students that we bring in every year that will matriculate into the program. Someone said that PA school is 2 years after you graduate and get your bachelor's degree. So all programs are master's level programs. When I went through PA school in graduated in 2000, all of the programs across the country were bachelor level programs. And so I got a second bachelor's when I graduated, and everyone, go ahead. Oh, sorry. Is it Cedrion? Do you have a question? No?
No, ma'am.
Okay. When I graduated, I got another bachelor's and you got a physician assistant certification, but now all the programs are master's level programs. So not all of them are 2 years. The majority of them average around 27 months. So some are at 24 months. That's very few, because it's hard to get the 7 core rotations that you have to get before you graduate and get your finish, everything you need to graduate with that particular program. Outside of the 7 core rotations, some programs have, maybe 2 electives, some have 3, some have a little bit more. We have 4 elective rotations. And so most programs are 27 months. Ours is 27 months. And there are a few that are actually 3-year programs. And most of those programs are located or housed within the medical school. And so those students will take classes with the medical school, and then they will kind of veer off at the end to do more specific hands-on activities that are related to PAs as opposed to MDs, okay? When students apply to our program, we basically have the same prerequisites as medical school, and I'm not going to get into all the prerequisites. Most of the programs that you may apply to are you'll have to complete anatomy, physiology with anatomy lab, organic and inorganic chemistry. Most of the programs will require you to do microbiology, also some type of psychology. So we have abnormal and normal behavioral psychology. And so pretty much on average, most of the programs have the same prerequisites. But what I really try to do with these talks is just introduce the students to PA profession, because we do need, although we have a lot of PA schools that are open up across the country, just to be perfectly honest, we do need a lot more of underrepresented minorities in medicine to go into the profession, because we have probably less than 10% of the profession is made up of that. But most of the population of patients that we see are gonna not really reflect the providers that are treating the patients. And so you will, especially at this time, or really not at this time, I would say over the last 5 years, there really has been a trend to increase diversity in the profession. And so I really just try to make sure that I touch a lot of different students in really as young as junior high school, because they really need to understand what a competitive applicant looks like, okay? That doesn't say that if you are a junior or a sophomore or a senior in high school that you can't reach that. But the mindset that you need to be successful in a program that is 27 months, and that is just as soon as you walk in, you are hitting the ground running, and you don't let up off that kind of momentum, that speed, until you actually graduate. And I think a lot of students, a lot of the, and remember, underrepresented minorities and diversity is not just about race. It's also about first generation scholars, students that are from a certain socioeconomic class, students that come from underrepresented healthcare shortage areas, All of that is what we call, you know, LGBTQ students. All of that is diversity in my mind, but in most students' minds. We really want to reach those students early on so they can understand what competitive applicant looks like. And believe it or not, when you go into junior high schools and high schools, a lot of them are shocked when someone takes the time out to do that. So just like you guys are here listening to me and learning about the profession, whatever you guys go into, whatever profession you end up being in, just make sure and reflect on the journey that it took you to get there, and make sure that you do the same with, you know, other students that are coming behind you. Even at the position that you're in right now, whatever level of education you're in, you can still serve as a mentor to those students, okay? So always keep that in mind. But so when applicants come in and they actually come in for the interview, we always ask the question that I ask you, and why, you know, why is it that you want to be a PA? Because there's a lot of different things you can be. You can be a doctor, you can be a nurse anesthetist, a physician, or a nurse practitioner. And so, you know, we really do look for people that understands the profession, that doesn't want to just have kind of a shortcut, or this is their kind of default profession. Because those PAs that you see that they got into PA school because they couldn't get into medical school, they are actually the most difficult people to work with because they kind of walk around very frustrated because that's not what they want to do. So I have a daughter in grad school, I have a daughter in college, and I have some little elementary and junior high school kids as well. But I always tell them to make sure you understand what you want to do and why you want to do it. Because if you think about why you want to do it, there's a lot of different ways that you can get there. So PA profession may not be the only means to get to where you want to be, but make sure that you are fully aware of all of your, the different professions that you can get into so you can make the right choice. So what we want to hear the students say is that, you know, they have a passion for healthcare. They really want to see patients. They may not want to take on full responsibility of managing a practice, and be the one that is in complete control, and have that responsibility, but they do want to work with the team. So PAs work in a team with a physician, so a supervising attending that has to kind of sign off and look at about 10% of your patient load. We also listen for the flexibility that you may not want to just settle in one profession. You do like the flexibility of going from even different specialties in medicine. You can wake up one day and work in dermatology, and or you can wake up in family practice, and maybe in 3 years after you get married and have a kid, you want to work in dermatology and something that's a little bit more flexible. And then the other thing is the financial aspect of it. You don't want to, you want to get into a profession, get trained, and come out. And I always tell students to kind of put a spin on the financial. You want to come out and have access and start managing patients right away, instead of waiting for 4 to 7 years, because even though medical school is 4 years, you still have about 3 to 5 and sometimes 7 years of residency. And so that's kind of the things that we really listen to. So someone said that, you know, it's only 8 to 5. I think that was Sandia. So no. Some PAs, the doctors may offload on you because you are the PA. And so the doctor may work 8 to 5, or they may come in 9 to 3, 9 to 4. And sometimes the PA is coming in early, so 4 o'clock in the morning, especially if you work in surgery, to round on all those patients and get them all tucked away and ready for the doc to come in. And then when that doctor leaves at 3 o'clock, you'll stay there to 5, 6, 7, 8 o'clock to make sure that they are set for the evening. So that's kind of a misconception in some ways, and I've worked on both ends. I've worked as a PA and a physician. In there are times that you are working actually even harder as a PA because you are, you're basically kind of filling in and doing the things that sometimes, if they treat you this way, sometimes the doc doesn't want to do. All right. And this is really why when you go into the profession, you know that's what you want to do, because if not, you may get burnt out. Okay.
Dr. Guilford, could I
yeah.
interrupt for a second? So you were talking about admissions. So we've learned about medical school admissions being the holistic type interview and application. Can you speak to the kind of experiences that are looked for in PA applications and what you consider strengths for those?
So we've tried to, most programs with this whole diversity push in the past 5 years, a lot of programs have really restructured and reevaluated their admissions process. And so we do hear this term holistic, admissions process being used quite frequently in the medical field. So whether that's when you apply to medicine or the PA program. When we say holistic, previously in years past, most of your application processes really just looked at GPAs and grades. They may have they also looked at a little bit about community service and things like that. But they really focused on GPA and your any type of standardized test that was needed to get into the program. And so, what you find is when you do that, you weed out a lot of students that may not have had access to a lot in their educational experience, but that doesn't mean that they would not be an exceptional practitioner. And so we have tried to make those processes a little bit more holistic. So in doing so, we still look at, so in the PA program, we have a pre-interview process, and then we have an interview process, and all of those are kind of weighted and scored. So the pre-interview process, we do look at GPAs. You need a 3.0 to get into our program. In most programs, that is the case. There are a few across the country where you need a 2.5, 2.7, and there's some that you actually need a 3.5 or 3.6. But with our program and with UAB grad school, you need a 3.0. So we look at GPAs. We also look at clinical experience. And so we have something that we categorize as hands-on kind of patient contact, and then patient contact that is not direct patient contact. Different schools, they will classify different jobs as either direct or indirect. The big thing that people really try to do before they get into PA program to get some experience is a medical assistant, some type of a tech. So you have radiology tech, you have respiratory tech, you can have interventionalists, when they do like the cardiac casts and things like that, you can do a tech that, even pharmacology tech. And then the second big thing is a scribe. So a lot of people, they will work as a scribe. At UAB, we categorize a scribe as indirect patient care. But places like University of South Alabama, they will categorize that as direct patient care. So make sure that you look at that. If I was a student, I would try to do something that is classified as direct across the board, which is like a medical assistant who is actually putting their hands on patients, taking vital signs, doing injections sometimes. They'll give medication and kind of things like that. Of course, direct patient care is a lot more competitive than to have indirect patient care. And we really kind of look at the hours or the years that you have worked in those positions. The other thing we look at is, we used to look at GRE, but when we made it a more holistic process, we look at the GRE, but it is not weighted in the interview process. So we will look at that in the pre-interview process. And then we look at community service but that is not weighted. And then we also look at shadowing. And so when you every program looks at shadowing. We look at it by the time, so less than 6 months, more than 6 months to a year. We always try to make sure that you have shadowed a PA, because you really need to know the role of a PA, the difference of the PA, and how they work in actual practice. I know there's a lot of shortages of PAs, especially in the South. And so, you know, if you work in a rural area, you may not be able to shadow a PA, but I would just say try to at least shadow a PA for a few hours if you can. Otherwise, if you shadow MD, that's all you can put on your application. The other thing that we look at in the pre-interview is your references as well. And so we always look at, make sure you have references that are not family members, you know, people that have really looked at you, has served as a mentor, or someone that you have worked with in a professional setting. So that's kind of a holistic process, and that is just paper. We're just looking at paper. And we also look at your personal statement. And in the personal statement, we are looking for those 3 or 4, you know, triggers. So altruism, words. So we're looking for, you know, altruism, financial, flexibility, time, and to know that this is what you have always, or you want to do. It's not, we can actually read into a personal statement and find someone that wanted to go to medical school and just didn't get in. So that's really the pre-interview cycle. Yeah. And then your interview, when you come in an interview, I tell all the students, we already know what you look like on paper. Every last one of you have met the minimum standards to get in. And so you really just have to sell yourself. Because, and this is exactly what I tell the students, you have to look at us and the faculty and evaluate this day and see if you want to spend 27 months here with us. And I have to do the same when we evaluate you. Do you fit into the mission of the program? What will you bring to the program? And is it, you know, a good fit for both of us? So I would recommend that you guys look at the mission statements in the schools that you're interested in. Also kind of peruse the website and look at their website and the pictures that they have. Some of them have social media pages. I would look at those and see if that is a good fit. And if you live close proximity to those schools, I would try to visit them as well and just see if it's a good fit for you. Because 27 months is a long time. What I tell the students all the time is, what if you, PA school is almost like literally like drinking from a broken, like a busted fire hydrant. You are not really able to come up, you know, for air and kind of breathe because you're just massive amount of information that is coming at you. And so if that is the case, then you want to at least make sure that your mental health is good, that it's in a program that kind of serves your needs, okay? Does that help answer your question?
Yeah.
Dr.
Yeah, there's also,
go ahead.
There's some questions in the chat. So I think Michelle asked if you, about going back to medical school. I think you answered that, but, and then Zykedra, if you want to ask your question, if you're still there.
Yeah, I'm here. I want to be a PA working within family medicine, and I go to UAB now, so that's one of the programs that I'm interested in. And so I was wondering, since it's more like surgically focused, would you suggest applying for the UAB program?
But you said you just want to go into medical?
Family medicine.
Yeah. So yeah, it is, because even though we are surgically focused, we don't graduate essays anymore. So you would be a PA. You would be, even in family medicine, that will suit you well, because sometimes I'm a family medicine physician. So sometimes we would get people that need sutures, that may have some type of injury that you need to manage with minor little surgeries inside the office. And so you would be able to do that. I would say once we opened up the program and renamed it, and now it being an MSPAS cert degree instead of an SA. We have about maybe 40% to 50% of the students that go into primary care or medicine, let's just say medicine, yeah. And we have, and it kind of changes, sometimes it's 60%, it'll go to 40% that actually go into surgery. And then some of those PAs that go into surgery, especially the female. So I will say most PA schools, it's a high ratio of females. We usually have less than 10 men in the classroom. And so a lot of those females that went into surgery when they first graduated, a lot of them will transition to medicine once they get married and have kids. I will say that the average age, most people don't believe this, but the average age of students that we have, I think is every year it kind of fluctuates a little bit, but last year was like 23. It's been 25 years, 27 years. So they're fairly young. And most of our students come straight from, undergrad to PA school. So you have these very young professionals that are entering into the medical field, which is good for us because that means that you'll be in the field for quite a long time. You'll be able to manage all of this electronic medical records and things like that a lot more than people like me. I look young, but I'm not at all. Can manage it a lot more, than us. I like my paper charts. So.
Sophie had a question too, if you want to ask your question out loud, and then Sydney.
Okay, and I'm looking in the chat too.
Ms. Guilford, I have a question. What is the difference? What is the difference in the curriculum in medical school and PA school? Like
okay, so while we're on that, I will answer your question and the one about the nurse practitioner as well, because it kind of relates to each other. So really, our curriculum is based off of the medical model, and which means that you come in, you have your the first type of courses you have are all of your primary science courses. So your anatomy, physiology, your lab courses, pathology, everything that kind of teaches you how the body reacts normally, the process of those normal mechanisms, and then what happens in the body when those things kind of go array and they're not checked. How does disease manifest? Well, how does it happen or occur? What happens at a cellular level? And then how does that manifest into a presentation of a disease process? And so that's kind of the model of medicine. So you have these basic science courses. In medical school, though, you have like a deep dive into those. So you're getting down to the biomedical part of that. You also have microbiology and epidemiology, embryology. So you're getting really deep down into the cellular, molecular level. PA school, and I did both. So PA school is about, I would say 2/3 of what you learn in medical school in 4 years, you are learning all of that in 1 year in PA school. So that is a lot of information. And when I say 1 year, most people say, well, it's 27 months. How's that 1 year? Because your whole last year of PA school, you're in clinical rotation. So you're applying everything that you have to have already, in your mind, understand 100%. And now you are basically practicing as a PA, but as a student, supervised by your attending physicians before you actually go out into working as a PA. Just understand that transition to practice. So once you go from PA school to working as a certified PA, they want you to be completely autonomous when you graduate. And autonomy means that you can see those patients without a lot of hands-on help from your supervising physician. So day one, when you graduate, they expect you to come out, be able to see a patient, completely evaluate them, and only consult with them if it's a severe patient with, very complicated and you need some help. But other than that, you are expected to be able to see those patients by yourself. And so you have to train under the same model as the physician, basically. So the difference between the PAs and the nurse practitioner is that they are trained under the nursing model. It's not the medical model. Nurse practitioners, when they graduate, they're trained almost like physicians. Instead of physicians graduate from PA school and they go into residency, nurse practitioners, most of them already have the track that they want to do. So they may be an OBGYN nurse practitioner or family practice nurse practitioner, and all of the rotations and things that they choose are under that will help train in that specialty, basically. So that's pretty much the difference, is the model that they are trained in school. Really. So can PAs perform surgery without a supervising physician? So that has changed. But like I said earlier, my parents are cardiothoracic surgeon, surgical PAs. My mom works at Cedars-Sinai in California, which is a huge hospital. I would say she's been a PA for 30 something years, more than 35 years. Less than 10 years ago, she was able to first assist, and she was able to open up the patient. So she did bypass surgeries and things like that. So she was able to go into the operating room without the physician, open up the leg, dissect the vein, the saphenous vein or whatever out the leg, clean it all up and get it ready to be used to bypass the obstructed arteries in the heart. I would say maybe less than 10 years ago, maybe 7 years ago or so, all of that has changed. So her scope of practice, she can't go in anymore and open that patient's leg up without the doctor at least being in there, like scrubbed in. He just has to be in the room. They may not have actively started the bypass in the chest, but once he's in the room, she can go ahead and start the surgery. And that is just that's all like politics. We're not going to get into all that, but that's really kind of the back and forth political war, or lack of a better word, between PAs and nurses, really. So that has changed across the country. I would say, listening to my students and living here in Alabama, PAs in Alabama, their scope of practice is a little bit less than most of the PAs that are practicing in the country. But they are not able to start surgeries without their supervising physician. Once the physician comes in, they do the surgery together, but they can't start that without them being in there. Now they have left, like you can close them up and all that without the physician being in there.
I have a question.
So I'll answer Michelle Osley in 1 minute, and I think I've caught up on the questions. Okay, go ahead.
So I'm still sort of confused about like what a physician assistant does, like what their scope of practice is. I don't really understand.
So basically, whatever a physician can do. I mean, generally speaking, whatever a physician can do, a physician assistant can do.
So can they prescribe? They can prescribe medication?
They can prescribe medication.
Oh, okay.
In California, I have a lot of friends and colleagues that opened their own medical practice and hired a physician to work for them as their supervising physician. And you just have to, different states have different licensing, things that are required of them from the medical board. But in general, the MD just has to review 10% of the charts that the PA evaluates, and they have to be within a reach via telecommunication, meaning you can call them, you can page them, you can send them an email. As long as you have a way to communicate with them that way, then then they can. When I was a PA and moved here to Alabama, I worked at Baptist Princeton Medical Center. I was there for 1 week, not even a full week, and my attending physician went out of the country. And I was there for 2 weeks by myself. with the practice, seeing 60 something patients a day. And my job was to see patients, all the new patients, any labs that needed to be evaluated, I did that. Any radiography studies, x-rays, imaging studies, whatever, that came through me first. I pulled the chart, contact the patient, let them know what we were gonna do in response to that. Any calls, I did that. And I also took call Monday through Friday, and she took call on the weekends. So that was my job as a PA. When I moved here. And I had prescribing rights. So in California, we had our own DEA number, and we can prescribe controlled substances as well. So every state is a little bit different. Every facility, healthcare facility, is a little bit different. Some facilities may not let you put in central lines in the neck. Some may not let you put in arterial lines. Some may not let you run a code if a patient, stops breathing and their heart stops beating. In some places, they will actually let the PA. So it just depends. But the scope of practice is very vast. Basically, in general, if a physician can do something, then their physician assistant can do it too. Most places, if your physician thinks that you are able to do something, then they will allow you to do it. And then someone, I forgot her question that quick. Please perform. Oh, why did you decide to go back to medical school? So I think I touched on that a little bit. When I moved here to Birmingham, no one knew what a PA was in 2000. And the people that did know what a PA was, because remember, they were called essays here in Alabama. And then you had a short period right before I came that they started calling them PAs, but really they only saw a PA in the operating room. No one really saw a PA in the private practice. And that's where I was working at Baptist Princeton in a private practice internal medicine clinic. But I was here for about 10 months looking for a job. I couldn't find a job because no one knew what a PA was. They didn't know how to utilize a PA. Many of them responded, so I need to hire someone to help me see patients and, kind of pay you to do that. Are you able to do that? So it was a lot, only because a lot of people weren't educated on how to utilize a PA. And I tell this to the students all the time. When I moved here, I tell my students this, when I moved here in 2000, this tells you how far we have come. When I moved here in 2000 and I got the job at Baptist Princeton, and I told you everything that I was doing, my whole scope, every day with those 60 plus patients daily, I got paid $35,000 a year. That was my salary. And so that is what pushed me to go back to medical school. I'm married to a physician. He's an ER physician here. We met in California, but he's the medical director there's a new ER here in Gardendale that he oversees. And so we moved here because he got a job at UAB, and I would come home just crying every day, complaining about everything that I'm doing. And he's like, well, just go back to medical school. So that's actually what I did. But I will say the profession has grown a lot. I think a lot of what I experienced was because of reimbursement. A lot of docs who, if they did hire a PA, they would not get paid for for them seeing patients in their practice because they weren't recognized by Blue Cross Blue Shield. But a lot of that has changed, and now you can reimburse, and so PAs are getting paid a lot more. Across the country, though, PAs in surgery get paid a lot more than private practice. So I think the average salary for PAs right now, just an average PA, primary care, is $102,000 to $105,000 a year. But if you work in surgery, you can go up to like 127, 130, 150. In West Coast and East Coast PAs in surgery make a lot more than kind of your southern and northern states. So.
There's a couple of other questions in the chat, Emery.
How was that transition? So it was actually really good. It was good. So when I went back to medical school, most of my physicians asked me what I did before I came back to school. So when I did my clinical rotations, it was good for them because most of them said, "Oh, it's almost like I have another colleague working with me." So most of the students kind of slowed them down, but being me having all that experience, I really was able to help them move patients. So I, worked a lot faster than most of the medical students that were with me. I will say though, my first 2 years, the didactic part, so that's the part where you're in the classroom, really learning about basic sciences and the practice of medicine, so clinical medicine, pharmacology, pathology, and all that. That was really difficult for me because I practiced for about a year, but I was also working before I went back to PA school. So I would say my prerequisites and all that were almost 10 years before I went back to medical school. And so that was what was really difficult, was the first couple of years. But once I got into the clinical year, it was full speed ahead. I was able to finish school in a short amount of time because I kind of doubled up on some of those medical classes that I had before, but it was good. It was a good time. My struggle was with kids. So I had 2 kids when I went through medical school, and then I had 2 more in residency. So that was a struggle. So the only difference basically is 2 years after school. No, there's a lot different. That's the time that's the different, but all of the information that you have to kind of compact in that short amount of time that's spread out in medical school is a lot different. So, yeah.
I have a question. So how did you manage to retain all the information that was given to you within the year time span, or how do your students tend to do that?
So we try to we have a hard time breaking them of being motivated by grades and being competitive. So the transition from undergrad to grad is not, especially if you're doing some type of health profession, meaning that you're not getting a degree in something that you can kind of just memorize, things that you can just kind of put in your head and grab that knowledge when you need it. Everything that you learn in PA school, and the students never understand this until it's kind of, before they sit for their board. They want to know, well, what's going to be on the test? What do I have to know? You have to know every single thing that we're telling you in the classroom, but also what's in the textbook, things that we're not telling you because you really have to be proactive because we can't tell you everything in that small amount of time in the classroom. And so you really have to get out of the mindset of the things that I know my performance is related to or indicative of a grade, because you can have a straight A in the class and you may be a student that doesn't even pass their boards, and you ask yourself why, and the reason why is because you memorized that whole 27 months. All you did was memorize, and you have no understanding of how to apply that information, even though we taught you how to apply it. And so I always tell the students, whatever you do, make sure you understand why you're doing it and what you got yourself into. You can't be upset and frustrated that it's so much information, because this is what you kind of signed up, to do. And that's just the nature of the beast. That's the nature of PA school. It's very short and we can't teach you everything. And so you have to be proactive, and you need to be active in that whole experience of your education. We kind of help lead you there and guide you there, but you really have to be actively involved to ensure that you kind of reach that level. And so a lot of students, they get so frustrated. They're like, this is my first C. I've never had a C before. I've never had to struggle to understand, what you guys are trying to teach me. And it's because we are making you, we can't really teach you. We can kind of help train you to critically think, but you have to start critically thinking. And that's the difference between undergrad and grad, that you are critically thinking. I think that's a hard thing for students to do. So what I always say is, it depends on the type of student you are. I was a visual learner, so I had to listen, I had to read first and be prepared for the lecture. So, and that was my first pass at the information. When I came into the lecture, then that was my second pass, and I actively listened, which means I'm listening, but I'm also writing notes. If you look at the information before, you don't have to write so many notes, because some of that you've already heard, and it opens up your, the possibility of you. I mean, it opens up your ability to just actively listen and understand and take in the information. And then as soon as I finished with that lecture, whatever I had that day, that's what I studied at night. And so you have to be very dedicated to time management. You have no idle time. I didn't have idle time because I had a family. But even if you don't have a family, you still have to make sure that you designate, you have a calendar, and this is every single day is planned out really for you. And that's kind of what I encourage the students to do. It takes them about 2 semesters to get there, but once they get there, they're fine. So the other thing is, if you're going to go into some type of healthcare, whatever it is, the ability to critically think comes from you understanding the information and being able to apply it. And that's how you know that you're not memorizing it. So I always encourage the students to make sure that they have a group. Make sure you're studying with a group, because when you're studying by yourself, if you ask yourself a question, who's going to answer it? You're going to answer it. How do you know it's right or wrong? You don't, because it's coming from you. And so that's why you really need people in your group to let you know if something is right or wrong. And that doesn't happen the day before the test. You need to do that throughout the whole week before the test, so you can make sure that you're processing the information. If you can actually have a conversation and talk about something, then you're able to critically think and apply that, because it's no longer just memorization in your head. You're actually applying it to something and actively learning. And so that's what I encourage the students to do. And that's what I would encourage you guys to do as well. Because day one of your health profession, whatever it is, a lot of the application processes you're gonna see may have changed as well. They may have what they call multiple mini interviews, so MMIs. And this is done at the interview process. And so they will put you in a lot of these different scenarios, and they really want to see how you communicate with each other, how you problem solve, how you bring other people into that process. And they're actually they're looking at you and evaluating your ability to critically think as well. And so, we look for people that have some of those characteristics ahead of time, so we won't have a difficult time training or honing those skills. So if you start kind of thinking about that now, then that will kind of help out as well. Okay, because most people nowadays are not just trying to train someone to be a clinician. We are training people to be compassionate as well. Like people that have great communication skills, people that get out into the community and talk to others, talk to their patients and things like that. So it's not just book education in didactic year. We actually do emotional intelligence. We work in the community at a homeless shelter for men. We do screenings for pediatric patients across inner cities in Birmingham. And so that's what we're looking for when we interview students and bring them onto campus. Okay, you touched on something about that. Oh, so someone asked how, I hope I answered Giancarlo's and Juanita Rao's question. If I need to go back to the transition question, then let me know and I can clarify that a little bit more. So someone asked what made me go into academics. So now I'm an assistant professor. What made me go into academics? So really, and this is going to sound so cheesy, I wanted to, or want to teach. So I really do think that my purpose in life is to teach. So even when I was in medical school, as I transitioned from being a PA to medical school, like I said before, a lot of my professors and a lot of the clinicians that I work with, the MDs, they could see that I had some additional training and kind of at a different level than some of my classmates. The thing that PA school taught me was it gave me excellent bedside manner. Now, I won't say that, I'm not saying that to say that if I didn't go to PA school and just went to medical school, I wouldn't have excellent bedside manner, because that comes from your personality and wanting to really touch the lives of people that you are seeing and not just look at them as a patient. But PA school really did teach me to really want to connect with patients and really be there for them in a role of more than just, you know, their practitioner. And so that I brought over into my MD profession. But I was asked to help my colleagues to learn how to do physical diagnosis. So in PA school, if the one thing that all PAs can do is do a history and physical. We can do a H&P head to toe, you know, in less than an hour, and it would be completely thorough. And MDs are really not trained like that. They may now, but in actually talking to them now, a lot of them are not trained that way. And so I taught my some of my students that were in medical school with me. I helped our professors kind of teach them physical diagnosis. And it was really fun, it was rewarding, and it was easy for me, and they really understood from the way that it was taught. They understood it a lot better than just reading from a book or even some of the other clinicians. And so that was my first taste of kind of teaching. And then I also worked as a medical consultant with Social Security disability, and I helped just kind of lay people evaluate medical records and see if people met disability and all that kind of stuff. So when this came up, my heart really lies with the PA profession. For me, I did MD kind of as a default. Like I always wanted to be a PA. When I was in high school, I wanted to be a PA. When I graduated from college, I wanted to be a PA. I never wanted to be an MD because I actually wanted to have 10 kids. That didn't work out, but I did want to have 10 kids. And I wanted a family life and not the profession. And so I never did want to do that. I went back to medical school with all of the kids. By the time I finished, you know, reflecting on what I was doing, I was away from my family a lot. With my husband being an ER physician, he was away. So I just thought someone needs to be home with these, you know, 4 kids that we have. And so a colleague of mine worked at UAB, and she knew my passion for PA, and she knows my family as well. And she told me about it. And so I applied, and I think it's the best decision. I am doing something that I think that I was called to do. And it is difficult managing 80 students at UAB, and you know, some other different things that are going on, as well as being a minority really at UAB, the first African-American program director, can be a little bit trying at times, I would say. But it is very, you know, it is very rewarding. And I think I'm just doing something that I was put here to do. So yes, I said 10 kids. If I were getting Dr. Wilson says. Yeah, so a lot of docs work in academics as well. So, you know, my husband is a medical director, but his title is assistant or associate professor. He works, so he trains the residents, he trains medical students, PA students come there. Some places, like when we first moved here, if he being an ER physician in academia, he did not make as much as his colleagues or his, friends that he graduated with in medicine, in residency. He didn't make as much as they did working in private practice or for, a private hospital. But I will say, what you don't make in your salary, it is more than compensated in your benefit package, basically, in academics. So if you are any field of medicine that you work in, you can actually teach, because all of those fields of medicine that you're in, they all have programs. So you can be a PA and you can teach in academics. You can be a physician and teach in academics, nurse practitioner, and teach in academics as well. And if you don't want to make that commitment to teaching on a regular basis, they do have adjuncts as well. And they also have preceptors. So you just precept students, which means you teach students on their clinical rotations without the commitment of running a classroom, basically. I was worried about this Zoom, but you guys asked more questions on Zoom than in person, which is good. That is good. And then I just... Yeah, and then some, I would say she asked about research too. In medical school, there are so many students and fellows and residents that do active research. It's a commonplace in medical school. PA school, there's not a lot of PAs that are practicing that actually do research. If you work in a facility, a health facility, so a hospital, a major hospital that has research dollars and funding, then they may do that if that is your passion. So we do have a dual degree program at UAB. We do have some students that are doing their master's in PA studies and also a master's in public health. And those students do an additional research project, and some of them did that because they do want to go into research when they graduate. But it's more common for PAs to not do research in practice. But every program, since it's a graduate level program, you have to either do a capstone project, which is a poster presentation. So you do research and then you put that into a poster and present it, or you do a thesis, which is a little bit more detailed. But most PA programs, you don't have to write a thesis.
Do we have any more questions?
My question was about why you ultimately decided to pursue family medicine in medical school.
So really because of my passion for patients and really what medicine should do. So medicine is the process of healing. And it's not, that can happen not just with prescribing medicine, but your communication, touch, your interaction with patients. And to me, that is what family medicine is. You are able to see patients before. So family medicine, our training is across the lifespan. So you're seeing infants, so pediatric patients, you're seeing teenagers, adolescents, to adults, and then also elderly patients, so geriatric patient population as well. And then you're also trained in OBGYN. So family practice physicians are trained to deliver and manage patients that are pregnant, but most of them don't have to practice that aspect of their job if they work in an inner city or rural city, urban city, because you do have OBGYN trained practitioners that are doing that. If you're in a rural area, you may have a family practice doc that is seeing and evaluating and managing patients that are pregnant. And so to me, I want to be able to see a patient and follow them through their whole, life. See them before they get sick, to try to intervene and communicate with them, the importance of being healthy and things that you need to do and put in place to stay healthy before they get to developing these common diseases like diabetes, obesity, hypertension, and things like that. And that's what the internal medicine doc handles. Most of them get those patients when they have already transitioned into an unhealthy state, and they have to manage that. And so that, to me, that's what family practice is, and that's what I wanted to do. I don't see how my husband, I tell him all the time, I don't see how he works in the ER. It's, just touch him for a minute. You may not even touch him. Let them know what they have, and then you never see them again. And I would be so worried about those patients, like what happened to them? Did I do enough for them? What was the outcome of that patient? And so that's not who I am. So family medicine was a better fit for me. And then really, I want to balance like my family life as well. So I didn't have my 10 kids, but I did have 4 kids. We have a 9-year-old, well, the oldest and the youngest, they both have the same birth date. So on the 7th, the youngest turned 10. We have a 12-year-old, a 19-year-old, and a 23-year-old. And so I still wanted some kids, and I don't think you could do that with like surgery. Pediatrics, I can't deal with I can deal with the patients, but I can't deal with the parents. So I didn't do pediatrics. And surgery, I can't deal with the surgeons and their personalities. So family medicine was my choice, or internal medicine. And so I chose that. In psychiatry, I don't know, I might be on the verge of being a patient at some point, but I did that.
Thank you.
You're welcome. Any other questions?
Yeah, we have about 5 more minutes if anyone has any last.
Oh, I usually don't take up all the time. Wow.
There you go. Well, we appreciate you taking this time with us. Thank you. Any last questions before we close the session?
Well, I'll say good luck to all of you. Oh, did she have a question? Oh, she's saying bye. Good luck to all of you. Please, if you take away anything from the conversation, make sure you understand what you are trying to achieve in the profession. So look at that first in a general sense, and then figure out what profession you can do to achieve that, and see if that aligns with what you're looking for in your professional life, but also in your family life as well. All right. And try to be as competitive as you can. And that does not always have to do with GPAs. I would never want a whole class, a cohort of 4.0 students. That is absolutely not what we are looking for. And we're one of the largest programs in the country, so I'm sure most programs are not looking for that. But we're looking for well-rounded people that have the book smart, or the ability to catch on in the information that's given to them, but also has the emotional intelligence to get through that, but also to connect with their patients and to work in a team, and someone who is going to graduate, work in a community, then not just come to work, go home, come work, go home, that will be involved in that community and do some outreach and things like that. So that means that they hold in high regard, that community of patients that they're treating as well, okay? Being a physician is not the end all be all. There's a lot of other professions that can get you to what you're seeking for in an MD profession. If you guys need anything, just Dr. McNicholas can give you my email address, and don't hesitate to contact me if you need anything.
Would you like to add your email to the chat?
Oh yeah.
We can post it too on Canvas. Well, I'm going to start just for the students, I'm going to start a list of all the people who've been on our sessions, so you have those emails in one place as well. And I think Miss Carolyn's going to want her photo up, so if you can share your video for just a few moments so she can take a good picture.
Oh, wait. Ooh, let me get ready.
Get ready.
No, just wait.
Augustine, Amaya, Isophie, Cedrion.
Oh, the people on the front.
Yes.
Oh.
All right, y'all, on the count of 3, 2, 1. Got it? One more page over. 3, 2, 1. Got it. Oh, Michelle Ousley, are you on or?
Oh,
Yeah, I am. I don't think my video's working now.
Oh,
There you
it's
are. We can
class
see you
on
now.
real quick. All right. On the count of 3, 2, 1. Got it. One more page over, and the count of 3, 2, 1. Got it. Thank you all.
Thank you.
Thank you. Thank you so much, Dr. Guilford. We appreciate you.
You're welcome.
spending the
Anytime.
time. Excellent information for everyone. Thank you.
All right. Have a good one.
All right. See you later.
Bye.
Thanks. Bye-bye.